So gastric balloon is a non-invasive or a non-surgical option in a way, where you can have a temporary tool to work with to achieve some weight loss. There are two gastric balloons that we commonly do. One is the Allure, which is the swallowable pill, as it's like to be called. So this one is a fairly straightforward procedure to do. Come to me on that day and I help you to swallow the capsule, which is a little bit bigger than, I would say, a paracetamol capsule. And I confirm it on the x-ray that the capsule has reached your stomach. And once it has reached your stomach, I blow the capsule up with a pint of liquid, so 550 mils, and it turns into the balloon. Okay. And the other balloon that we do is Overa balloon, which is an endoscopy. So it's a bit more of a procedure, but it is still a gastric balloon. It is not an operation. There are no cuts involved, and is completely reversible. So this procedure is done under mild sedation. What that means is you're not completely put to sleep. It's not anesthesia. All it is, on the day, I'll put a needle in your hand and give you some medication to relax you and make you a little bit drowsy. Once we have done that, I'll do an endoscopy, which is a telescope which goes down your mouth into the gullet and stomach. Make sure everything is okay, so I check everything out, and once it is safe, then I'll put the balloon the same way. Again, it is inflated by about 550 mils of liquid, and that balloon can stay in your stomach for up to 12 months, at the end of which it needs to be removed in exactly similar fashion with an endoscopy. Endoscopy is a very commonly done test. I sometimes do about 20 in a week. And it is a very straightforward test to do. It's not an operation, and most of the patients tolerate it really well under mild sedation. The way gastric balloon works is either of them, they make you feel full, because it's a big, heavy, fluid-filled balloon occupying most of the space in your stomach body. And as a result, you feel full. You can reduce your portion sizes. Secondly, there is good data to show that it also slows down the emptying of your stomach. So whatever small amount of food that you eat also stays in your stomach for a bit longer, so you don't feel as hungry in between meals. And that is how gastric balloon works. Key thing about gastric balloon is to use it as a tool and make changes in your diet and lifestyle, because it is a completely reversible process. Once the balloon is out, you're back to as you were, and unless you have worked with it to adapt to your diet and lifestyle, you are at risk of putting the weight back on. And that is one thing where the aftercare that we offer, the follow-up that we offer, the initial assessment that we offer for suitability for the gastric balloon, the entire process is streamlined, and the entire process is there to support you. Gastric balloon is a very safe procedure to have compared to the operations. The major risks are very, very rare. We prepare you to receive the balloon, so you will start on some medications which are there to reduce the release of acid in your stomach at least a week to 2 weeks before the balloon goes inside your stomach. We also start you on an anti-sickness tablet, which one tablet you take before the balloon goes in, and you take the anti-sickness tablets more so in the first 2-3 days after the balloon placement. Again, it is important to follow these, because most of the patients will experience some sickness, some acid reflux, some cramp-like pain in the first 2-3 days. Follow our advice, stay on liquid diet, and take the medications, and these symptoms settle for most of the patients. Sometimes they don't settle, and you are at risk of what we call as balloon intolerance. So that means that typically a week, 2 weeks down the line, still you're struggling with symptoms of vomiting or acid reflux. Then we may have to remove the balloon for you sooner rather than later. That risk is rare, but it's a small possibility. And apart from this, anything else major like risk of balloon rupture or risk of any injuries inside or risk of bowel blockage, these things are very, very rare. Overall, even with endoscopy, the Obera balloon is very safe to